It is indeed my pleasure to be with you this morning and speak on behalf of the Duke Endowment. But first, let me say it is a real honor to be at this club. This club has a long and distinguished history in the role in the life of Charlotte, and I can only imagine the many conversations that have taken place among you and your predecessor members that have made this city the city that we all enjoy and are so proud of today. Take a few words. What I'd like to do over the next few minutes is talk a little bit about the history of the Duke family, which led to the establishment of the Duke Endowment, a little bit about our operations, but primarily what we're trying to accomplish with our funding in the Carolinas today, given the parameters that Mr. Duke set for us. The story of the Duke family really began with Washington Duke, the patriarch. As the story goes, he was a soldier in the Civil War for the Confederacy, was captured and was in a prisoner of war camp near Wilmington, North Carolina, and after the war walked back to Durham, probably up Interstate 40, as best I can tell. And when he got back to Durham, as the story goes, what he found was that his wife had passed away, that he had 2 surviving sons and a surviving daughter, an ill mule, and in one corner of this barn that still stands today was a little bit of tobacco that wasn't taken. He and his sons chopped up the tobacco, which was the way of selling tobacco in that day, putting it in the little pouches, and they began around the Durham area of selling tobacco, and each successive year grew more and sold more. James Duke, Washington's son, was the businessman of the 3 of them, along with Ben, who was the family philanthropist. And his technology break in life was he found an inventor in Richmond, Virginia, who had a machine that would take tobacco, spin it, and put a little piece of paper around it. And you can sell a lot more tobacco wrapped in a cigarette. And that was the technology break that gave Duke the step up on the other competitors of many, many tobacco companies at the time. Fast forward to about 1910, American tobacco had something on the order of 90% of the world's tobacco market share. You can clearly make a lot of money with that kind of market share in your business. But that also got the attention of Theodore Roosevelt and Sherman antitrust laws, and along with Carnegie, Rockefeller, and other big industry leaders of that time were forced to divest himself. James broke apart American tobacco and got out of the tobacco business and turned his interest to many other things. Fortunately, for one of those interests for us in Charlotte was connecting with 2 doctors, the Wiley brothers in South Carolina, who wanted to electrify the Catawba River. Their idea at that point was clearly an economic development play. Up until that time, if you wanted to build a textile mill, for example, you had to base it on water so you had a source of power. Their idea was to put the power plant on water and then distribute electricity on a retail basis. And so that led to much of the industrial manufacturing strength in the early part of the 20th century in the Southeast, especially the textile industry, of having a ready supply of electrical power. In 1924, Mr. Duke took a number of shares of Duke, what was then Duke Power stock, and created the Duke Endowment with the gift of those stock. And for many years, the Duke Endowment was the largest shareholder of Duke Power. And he said in 1924 he wanted to establish the endowment with a gift of $40 million. $40 million in 1924 dollars, which was a remarkable feat. He lived, unfortunately, only 9 more months, passing away in 1925, and then left with his will an additional $67 million. So essentially the endowment started with a contribution of $100 million to operate as 1925. He chose that as an idea, and we see this in his papers and his writings. His idea was he was so proud of what had become of Duke Power. He wanted to take some of the earnings of the company and use the endowment to plow them back into the lives and the welfare of the citizens of the Carolinas. And the endowment was the vehicle that he chose to do that. And he chose by selecting areas of caring for children, of health care, of education, and of rural church. The strategy that Duke used in designing the indenture, and one that we operate under today, had, I think, these 3 really key parts that were different from other philanthropists of his day. One, he selected North and South Carolina. And I think that says a lot about limiting a focus. It gave us a focus that has served us very well. He actually has a clause in his indenture that says, I may have included other areas and other topics, but I think I would have accomplished less by attempting to do too much. I think there's an important lesson in there for us all. So to have that amount of money, but limited to the Carolinas, has allowed us a personal relationship, and I think a deeper relationship in each of our 4 grant areas. Secondly, unlike other philanthropists of his day, Ford, Rockefeller, and Carnegie, they tended to select issues. Now, issues come and go, and they are generally very broad. Duke selected organizations, and that has paid to us dividends because, again, it's allowed us to develop a relationship with very important organizations in North and South Carolina, and in turn have them do what they do really well in their respective communities. And lastly, a clause that we refer to as like charitable purposes. He knew from 1924 that the Carolinas were going to change. So he gave our trustees the ability within those 4 areas to modify and to make the changes in the grants and the things that we support, and you'll hear me refer to that more in a few moments. Just as a point of history, the original $40 million gift and the will of 67, this summer we should cross $3.4 billion in gifts that we've been able to do off of that corpus, and the assets, depending on how the stock market's doing today, is around $3.3 billion. Each year now we're running at about $120 to $140 million of contributions annually, and that varies depending upon many of our multi-year grants and depends upon when organizations and grants are ready for those payments. The people on the left in the color photographs, many of you will recognize. There are 3 of our current trustees from the Charlotte area. The 3 gentlemen on the right are former trustees from Charlotte, and if memory serves me correct, at least 2 of those were members of the Charlotte Rotary Club during their lifetimes. We have 15 trustees. 10 of the 15 physically live in the Carolinas, the other 5 are native of the Carolinas, so we have a very Carolina focus on our governing board. As I said, Mr. Duke chose the 4 areas in which that he encouraged us to work. But the way we think about working in those areas goes back to his focus on organizations. So we start in the beginning, in the center, and believe very strongly that if we can help the organizations that Mr. Duke named and encouraged us to support to be as strong as we possibly can, then that has the ultimate multiplier effect. You know, the amount of money that we'll give any one of those organizations is actually a relatively small part. They've got to raise more, they've got to generate more to be the organizations we want them to be. But we'd like to be that core underlining support that helps them have that edge, that makes them stronger, that you may find organizations of similar natures in other parts of this country. Now then, we would take those strong organizations and recognize what they do well. And if there is an organization that does a project really well, part of our money then goes to, part of our strategy then goes to block us on the left-hand side, which is replicating those successes. So if you've got an organization that does something really well, you want to take it to point B and point C and point D in other locations around the Carolinas, and that's a significant part of what we're trying to do, is to figure out what works and then spread it around these 2 states. Lastly, on the darkest purple, there's some awfully smart people in the Carolinas. And we'd like to have some funds that we can support them for innovation, for exploration, and for figuring out simply how do we do this better than we're doing it today. That's a high risk area, but that's one of the beauties of a foundation, is that everything we fund doesn't have to work. Some of it ought to be experimental. As a matter of fact, if everything we fund works, we're probably being too conservative and not taking enough risk in our work. So to the areas that Mr. Duke charged us to work in. First, child care. His actual words were orphans and half-orphans. But then step back to the 1920s, the way you took care of a child then was that without benefit of parent or one parent, was place them in an orphanage. And so for many, many years, we supported the 45 or 50 orphanages that were in the Carolinas. Increasingly though, our trustees recognize as times change, what that child in an orphanage was at risk for was vulnerable for success in life, and that the orphanage was taking the place of that parent. Today we recognize, while they're not orphans in that historical sense any longer, There are orphans that are orphaned by virtue of situation, of societal pressures, of any number of things that causes them to be at risk for abuse, neglect, or failure to thrive. So we work with those historical organizations, for example, in our county, Barron Springs, Thompson's, Alexander's. And those are great examples as they have morphed from just being residential child care to a wide range of services that take care of that spectrum of needs of children that are at risk have in their lives. And we do that by first trying to work towards prevention and early intervention of things that make a difference. For example, we have one program that statistically is doing well for us, which places a nurse who the children's organizations and other groups will identify a child at risk, a first-time mother, places a nurse with her as soon as we can identify them as expecting that first child, and will stay with the mother and the child through 2 years of life. And if you can have that start of coaching with an expectant mother, those outcomes become substantially better than any control samples without that experience. Secondly, the spectrum of out-of-home care. Placing a child in a facility is probably the last thing. There are many steps that we can help the system do better, be that counseling to the families, counseling to the child, improving foster care, and ultimately the residential care if that's called for. So our grant dollars flow in those two different strategies. Healthcare of all of our areas may have been one of the more complex ones over the 90-year life of the endowment. Again, step back to 1924. The first health insurance plan was for teachers in Texas in 1929. The concept of health insurance wasn't there when he set up the Duke Endowment. Likewise, he would never have anticipated a Medicare and a Medicaid in the 60s or Obamacare in our time now, all of which have had dramatic effects on the healthcare system. And so it is through these 150 or so hospitals and other related health organizations that we try to make grants to improve the health systems of the Carolinas. A big effort of ours, significant effort of ours, has been around quality and safety. So when you go to your physician or to a hospital or to a public health department or to a rural clinic, there are invisible systems in the background that are working, that are sharing best practice, sharing data of how do you treat a patient, how do you care for a patient in the most effective, efficient, and the safest way possible, and a huge investment of ours in the last 10 years. Secondly, access to care. Regardless of payments, in inner city areas, and especially in our rural areas in the Carolinas, access to care, to be able to get someone to see you for medical needs other than walking to an emergency room is a real challenge. And even if you've got health insurance, in a lot of areas there's still a lack of medical providers. So a substantial part of our dollars and strategy goes to being sure that we have adequately and well-trained people and their systems there to see people in need. And then lastly, in growing for us, is prevention. I suspect if I'm lucky enough to be invited back 5 years, the majority of what I would say would be around prevention, because we simply as a society have got to be better at taking care of ourselves and being more healthy. And whether it's obesity, whether it's prediabetes, whether it's any number of other array of activities, we've got to figure out how our society maintains health, maintains exercise, rather than waiting until we're sick and broken and need fixing at that point. So that will probably be in healthcare our growing area of support. In higher education, Duke took a different tack. Instead of naming all private education in the Carolinas, he chose 4 schools and did so by name. We have good indication of why Duke and Furman were selected, less so by Johnson C. Smith and Davidson. But in those schools, there are 4 colleges in very distinct marketplaces, one from the other. We want in any of them that if a child wants private liberal arts, then Davidson is a great example. If you're a person of color, if you want the experience of being on an African American or a minority campus, then Johnson C. Smith is going to be as good a choice as you can find in the Carolinas. And so a fair amount of our funding is going to ensure that there's an excellence within those schools as far as the student experience. Secondly, we're moving more and more dollars to access because education is so very expensive and changing in that, but also increased emphasis on attainment. And Tony would tell you a lot about that. I rather suspect that the tradition of finishing high school and going to college for 4 years and finishing It's actually going to be the exception in our society rather than the rule as we move forward. We're going to see more children going to college and working part-time, therefore they're going through college in more than 4 years. We're going to see students drop out to do things and go back to finish. We're going to see different methods of educating children which may involve multiple schools, combinations of 4-year schools and community colleges. The process, but the ultimate goal is not to graduate. The ultimate goal, we think, is to have that degree, that certification, that professional credential that will allow them to have gainful employment. And so whether it is online courses, whether it's any number of other ways that are emerging in higher education, we're trying to help our 4 schools be current with that. And lastly, these are bright kids that are on college campuses, but we don't want them just being in the classroom. We want them engaged in the communities and where they're working and being a part of that. So there's a fair amount of support for those type of programs. Lastly, in Methodist churches, and Mr. Duke only selected churches in North Carolina, and in that he selected very rural churches, churches in communities of less than 1,500 people. And you can see the statistics up there. But we think that was actually a great move on his part because that gives us a physical outreach in rural part of North Carolina, which needs a great deal of help today. And so our support there is to, again, try to keep the church organization strong as it is. But also we've made major investments in clergy and lay leadership under the assumption that if our churches are well led, if church members have training in leadership, they will not only do that in their church, but they will also do it in their community and be a spot of light that can help a community that may be struggling simply because there are people trained to do it better, to lead better, to manage better, that they got that from the church experience. And lastly, we can prove almost statistically that it is not the appearance of the church or the size of the church or the newness of the church buildings that makes the difference. It is the engagement of the congregation and the community that makes the difference. And so a number of our projects are after-school programs, literacy programs, clothing closets, food pantries, where we're trying to be sure that you couple good leadership in a rural community with a number of services also that make that community stronger and a better place to live, even with all the challenges that they have. These are a few examples, some I've mentioned already, of organizations that we fund in the Charlotte area. Most of these are on a repetitive year-over-year basis, simply because they've accomplished what we wanted them to become. Good, strong organizations that are producing far past what the Duke Endowment has put in. Lastly, a few comments about philanthropy and giving itself. As I said, we're 90 years old as an organization, and over that time, we've changed our strategy, we've changed our goals and what we're trying to do. If you think about the Carolinas, in 1924 when the endowment was established, it was in 2 states that were coming out of Reconstruction, right on the very eve of going into a depression. So the Carolinas spent a lot of the early and mid parts of the 20th century building. And so the endowment tried to help those 4 areas where we were charged to support, to build, and to build stronger. After about 1995, though, we recognized that society was changing and becoming more complex, and that's when our trustees started moving into the like charitable purposes of other organizations. For example, in healthcare, it may take us into hospice, or it may take us into a rural medical clinic, or related organization to the hospital that he named. The last 10 years, if you look statistically at our grants, you would see that we're doing fewer grants than we used to, but we're doing them at larger amounts and longer periods of time, simply because the type of issues that we're trying to address now, everything from birth outcomes to abused children to the care of elderly and senior citizens, we recognize that 2 years, 3 years simply isn't long enough to get the results that you want. So we're trying to stay with these topics on a much longer and a much broader period of time with more money, and it's, in essence, going deeper with these topics with good organizations rather than going wide. And so that leads me to the end of saying the challenges that we face as an organization, and I suspect you face as well as a donor, is understanding what really works. I spent a lot of years and a lot of miles driving around the Carolinas and many presentations. Our God, motherhood, and apple pie. You would look at them and think, of course, what a great idea. But at the end of the day, you don't really know if that project, as good as it sounds intuitively, if it really can produce. Story I use a lot. We've had one rural medical clinic that was seeing 100 patients a month, and another one that was seeing 120 patients a month. So intuitively, you would think that 120 is the better organization. But as we look closer, it was the one that was doing 100 was doing more with chronic disease, clients with diabetes, doing better referral patterns to the medical system. In essence, they were taking care of the patients better than the higher volume clinic was, who was just processing and doing more screens. That's the challenge with understanding what works, and we have that across all 4 of our areas. And we're spending a lot of time on that. At the same time, we're trying to do it in a manner where we don't drive the organizations crazy. It's spending a lot of time filling out reports, and we're trying to move that as electronically as we can. And lastly, one of the hardest issues I think we focus with, even as I said, we're trying to stay longer with some of these organizations, is how long do you stay with an issue? How much money do you put into it? When does a private philanthropy's responsibility stop and the organizations to pick it up and run it themselves start? When does an organization lose its edge of excitement about the project and replace that with just business as usual? And that's a tough call for any of us that are supported organizations for a long time. So finally, I think the challenge for all of us is to think about, when you sit down to write the check to support the organizations that you care about, think about, why are you writing that check? Is it an organization that you believe is indeed high performing and that you want to support it? And if so, I applaud your support for those, and I would only encourage you to add more zeros to the right side of your check. Because we have great organizations in this community, and they have become great because there's been a lot of support out of the Charlotte community for those that have done well. And that's a perfectly rational and reasonable way and reason to write a check. Secondly, though, you may also be giving to a cause that you care about. Equally as important, equally as valuable, but it's a different strategy, and you're asking different questions. It's a different time commitment that you're wanting about there. Lastly, I hope you all find that sweet spot where an organization that you care about and a cause that you care about come together in the same place. If you're there, then you really have something magical, and I hope you support it for a long time. Thank you very much.